Joining us in our newsroom, we have Dr. W. Graham Carlos, Chief of Internal Medicine at Eskenazi Health. Great to see you.
Hi, Mary.
So we have this new study that came out. People who've had COVID-19 who were admitted to the hospital, discharged successfully, yet 5 months later were readmitted. 1 out of 8 of those patients died. It's a pretty large study, over 47,000 people. Why is this happening?
So we know that COVID causes intense inflammation in the body. And when it affects the lungs in particular, that's why we have all that trouble getting oxygen into the body. And we're hearing of patients needing ventilators and more oxygen, et cetera. Well, the virus can cause inflammation in many organs in the body, in the pancreas and the liver. And so this inflammation, while we hope to get it under control with things like corticosteroids, it can be lasting. In other words, it can continue on in your body for weeks and months even after you've had the coronavirus. And that's why we're seeing patients with troubles with insulin resistance from inflammation in the pancreas. People are having inflammation in their lungs that's been persistent as well, and even in their kidneys. So it's not surprising to me that we are seeing patients weeks to months after overcoming the virus still have ongoing trouble with inflammation.
Mhm. So they appear to be dying from multi-organ dysfunction. So this is really what you're saying in terms of the inflammation, the heart, the lungs, kidney problems. So can you speak to that again?
Sure. So that the big study from the UK is not yet peer reviewed, so it's
Hmm.
hard to know exactly the details. In addition, they only looked at kind of 5 months out. But if you have chronic inflammation in any organ in the body, over time, that's going to lead to scarring and organ dysfunction, no matter if it's your kidneys or your lungs. So when we hear organ dysfunction, that's exactly what's going on, is these organs are just continuing to be inflamed and then they no longer work, and that can lead towards poor outcomes, readmission to the hospital, and worst case, death.
Hmm. And is there anything that we can do to prevent this aside from preventing COVID-19 and infection?
Yes, so the best thing is follow-up care. So many hospitals all over the country are discharging patients and then arranging for close follow-up care. Primary care doctors are paying attention to inflammatory markers, kidney function, lung function, etc. Unfortunately, some patients aren't able to follow up or don't choose to follow up. So one of the things I'd implore everybody to do is if you've been diagnosed and become critically ill with coronavirus, please do stay in touch with your primary care doctor so they can be on the lookout for these organ inflammatory diseases and potentially start treatments. Maybe it needs more corticosteroids to help get you through that.
Could this be happening and someone might not even know it?
You know, inflammation depends on the organ. Some organs, it's very clear. For example, the lungs, you'd feel short of breath. Other organs, it's harder to detect without using laboratory data or specialized imaging to pick up on it.
Mhm. And last thoughts, last 20 seconds. What's your message?
I think that it's not lost on healthcare workers that the coronavirus doesn't end when you're discharged from the hospital. We're seeing all kinds of sequelae, cognitive dysfunction, lung dysfunction, other organ dysfunction. So it's important for the public to understand that this is not just a one-time thing. Please do get your vaccine, follow up with your healthcare provider, and do all those other things that we're preaching: distance, masking, hand washing, etc.
Hmm. Can I circle back just to one more thing? It hasn't been peer reviewed just yet, the paper, yet 1 in 8 people after discharge and having to go back 5 months later. What do you think of that number?
Well, we just don't know how they were treated to begin with. So we don't know what therapies they were on. We don't know what kind of follow-up care they had. We don't know their baseline demographics, how many people had diabetes. We don't know what necessarily organ dysfunctions people had before they got coronavirus. So we don't know what was pre-existing, as it were. So there's a lot of question marks, and it needs to undergo a thorough peer review where they're asked those tough questions and they provide answers so that we can interpret it well. Otherwise, just it becomes a headline without proper context. It can lead to unnecessary fear.
Hmm. Yeah, a little bit of clickbait there. That's not what we want.
Yeah, you'll see like the Sun Times and European, headliners as scaring people, but
Mhm.
it needs to be cautiously interpreted, based on how they did their study, what information they obtained, all those kind of things that we see as critically important before we really put a lot of stock in something like that.
Mhm. Dr. Carlos, always great to see you. Thank you for your time
Thank
and
you.
of all the work that you do for patients and your contribution to science.
Oh, thank you very much. Best to you and yours.